welcome all our viewers and listeners into this podcast, Life Without Limits, because there are truly no limits to what you can achieve. My name is Joan Kaler. I am an international instructor of emotional freedom techniques. I help people around the world as an EFT coach. I help people with whatever they need help with, but specifically obsessive compulsive disorder and trichotillomania, the hair pulling problem. I absolutely love podcasting. I have 24 online courses, which you can find on my website, joankaler.com. Today is a miracle. Today, I have my teacher, my mentor of emotional freedom techniques, Dr. Craig Weiner. He is one of the most brilliant human beings I've ever met in my life. He and his wife, Alina Frank, are my teachers. They know everything about emotional freedom techniques, matrix reimprinting, OMG. And today's topic is on, okay, Joan, do not blank on this. Today's topic is on meta, M-E-T-A, meta health. What this is. I am going to welcome in my friend and mentor, Dr. Craig Weiner. Thank you.
Joan, I don't know how to even begin after that introduction. And I also think it's important that, that especially after introductions like that, that we actually show our humanity and mistakes and foibles and mispronunciations, because we're all learning, we're all growing, and this is really a journey for all of us. So thank you for that very warm introduction. I appreciate it. And yes, that's what we're going to be talking about. We're going to be talking about the connection between emotions and life circumstances and trauma and health through a larger meta perspective. Yeah.
So for those who don't know, what is meta health? Talk to us about, define it.
Yeah, well, let's just kind of meta, right, is I really look at as a larger viewpoint, right? A meta perspective, a greater worldview of something. But when we capitalize it, there's some history to what meta health is as an approach. And so I've been studying it for the last several years. I'm a certified practitioner. I'm working towards becoming a trainer of the work. And yes, you said, so what I do, I'm a chiropractor. So I bring that view to my patients. I work with people as a trainer in EFT and matrix reimprinting, as you said. And a lot of times people that come to me or questions they have is how to apply this tapping work, for example, to chronic health issues. So meta health, I need to give a little bit of history of what this is. It is an approach. It is an inquiry that is used around the world by a whole host of professions, from the medical profession, the tapping profession. Many different professionals come with different tools. So I look at really as a level of investigation and inquiry for helping to make the connections between what we've lived through and the stress that has on us with physical and mental, emotional well-being. So the history is that it really grew out of something called German New Medicine. And German New Medicine was developed by a physician in Germany, Dr. Hammer, and he passed, Roka Hammer. And so the brief story is he, as many other people, had a trauma in their life. He had his son that was killed, and shortly thereafter developed a type of cancer. And he knew that they were connected. Okay, just like, for example, the story of my wife, who she shares this publicly, is that she had a stillborn, and shortly after that trauma had developed an autoimmune condition. So there's this feeling many people have that when they live through some sort of traumatic event, and then there is the onset of some sort of condition, whatever that is, that they intuitively understand that there's a connection. So what Dr. Hammer did is he realized, amongst many others, that there was this connection. He mostly worked with cancer patients. And so what he started to find was this interesting phenomenon between the types of traumas that people live through and the types of conditions that they develop, especially the type of cancers. And he started to find that not only that, but there were themes between what types of conditions, where they were located in the body, what types of diagnoses they were, correlated with different types of traumatic events. And that really began this kind of drawing of a map and drawing connections and themes and understandings between conditions people develop over time from the types of traumas they've lived through. So that was the onset of this in the last century. And so as he developed this, many other people from the tapping community started to say, you know what we do all the time is we work with people to help overcome the traumas they've lived through, to heal and integrate and learn the lessons from them. And they were noticing as they were doing that without the specific meta focus that people's were healing, okay? That people were able to heal things in their body, and they were starting to already make this connection between the release of trauma and healing from chronic conditions. So it became more formalized as an approach through the tapping world and through other types of modalities that are complementary to EFT and tapping. And so that next generation became what was called meta medicine, which has then developed into meta health. And so what I want to say about that is, as we understand the connection between the traumas we've lived through and the types of conditions that develop, there are many tools that we can use to help disseminate, resolve, release, heal from the traumas we've lived through, right? EFT and matrix reimprinting being some of them, but certainly not the sole one. So we'll just say that it's an inquiry into understanding the connections, what we call the biosociological connection, actually the psychological, biological, sociological connection between things we've experienced, conditions that develop from that, and how we begin to unwind those to allow our bodies to decrease that stress and heal from that. So there's a snippet beginning for us to start with.
It's fascinating to me because I think of course, you're the chiropractor, the limited knowledge that I have on physical health, anatomy, and physiology. When something happens with an organ of the body, or when a dis-ease or health problem comes up, then that would be associated with a trauma.
Okay.
Okay.
Well, let me actually give a slightly different twist.
Okay.
I know you know, but perhaps many of the viewers or listeners do not know about the ongoing research into the world of what we call ACEs.
Yes.
Right?
Yes.
So here's a good beginning start. So ACEs stand for adverse childhood experiences, early childhood trauma. Okay. So we know the Felidianda beginning study with Kaiser and 17,000 people in the study began the process of really making a very well validated connection between traumas that we experience as a child and adult behaviors and physical health and well-being. So I'd say most people understand, all right, if you had a rough childhood, maybe that affects, your attitude and maybe, things you do, but it is so well documented. When they did the original studies, they looked at only, at that point, they developed and clarified 10, right? So childhood, emotional, physical, sexual abuse, parent abandonment, somebody in the house being dependent on a substance, somebody being perhaps having mental illness, somebody being away at jail. And they named 10. Of course, there are many more than that. But there was a beginning 10. So just with those 10, as a child, as our brain and bodies are developing, here's some of the sequelae. So for example, if you have 0 of those ACEs, right, then we start to look at 0 and maybe 4 or more. Well, if you've had 0, your chance of using alcohol is 1 in 69. If you've had 4 or 9, it goes down to 1 in 6. Mm-hmm. If you are somebody that didn't have ACEs, 1 out of 16 smoke, 1 out of 6. But when you start to look at physical health, you start to look at substantial increases in chronic illness, depression, addiction, heart disease, cancer, lung and thyroid disease, autoimmune conditions. If you have 6 or more ACEs, your life expectancy is decreased by 20 years. So when you start to look at especially early trauma, it's not just about how we feel about ourselves. It has very large chronological over time where sometimes it doesn't show up till decades later. So if somebody comes in with heart disease to their doctor, they not only need to be talking about just what they're eating or smoking or drinking, but what happened to them earlier that may have had a very strong role, perhaps even more than diet, in the development of their heart disease. So this body-mind, stress-body connection is very well validated.
And the truth is, when does that happen, that somebody goes into their physician and the physician or nurse practitioner or whomever says, oh, and by the way, what traumas have you had in your life? Zilch, zip. That.
Now, what I will say is there is some encouragement. We have some encouraging things. So for example, if you're not aware of this, there's a wonderful TED Talk by Dr. Nadine Burke-Harris, who's a pediatrician in Oakland. And she is now this, and so she's a huge advocate of trauma-informed care, understanding the role of ACEs in a person's health, and is now the Surgeon General of California. So, we are making headway in understanding the connection between trauma, adversity, especially when our bodies are developing as children, and the role that that plays in chronic health conditions.
Oh, God bless California. May it swiftly move to the east.
And it is growing. We see the idea of trauma-informed care within schools, penal system, and especially healthcare growing across many states in many different ways. So it's not just California, but that was recent this year. So it's a nice kind of pinnacle of, wow, we are making a difference with helping people to understand this connection.
So then someone comes in, and then that is one of the inquiries with their particular problem, whatever it is, God forbid, heart disease, cancer, whatever the chronic condition is. And then hopefully they're led to someone who can help them release the trauma, deal with the trauma in a perfect world, and a qualified certified EFT practitioner through EFT International.
Well, let's say this.
Yes.
Because we have a ways to go with that. We certainly have a growing body of research that shows EFT to help with a variety of chronic physical and mental health conditions. Okay. So we certainly have studies that show EFT to help with anxiety and depression and PTSD and chronic pain, and it's growing, right? But it's a long way yet from being able to validate and publish studies that say, great, I have heart disease. If I go and release the trauma of this, that will help my heart to heal. So we're still a lot of way of publication. It's not that people don't see that in their practices all the time and people don't experience the release as I see with clients all the time. But we still have a long way of validating that in the research where people say, oh, well, you have this liver condition, therefore let's look at the traumas, let's release that so the liver heals, right? So right. Let's be judicious in what we're stating.
Okay.
However, what I will say is when I speak with a client and they're wanting to explore a meta perspective, they said, you know what, I understand that there's at least some emotional role in my condition. And whether it's causal and started it, or whether it just seems when my stress levels are higher, the symptoms increase, the pain gets worse, my hormone levels fluctuate, etc. So most people understand that there's an emotional stress connection with, and that's well documented as far as the emotional stress connection. When stress goes up, physical conditions worsen. So on the flip side, we're just saying, look, if we can decrease the emotional stress that's going on with regard to this and the connections, then the body has a better chance of healing. And when I begin with a client, I'm not saying this, therefore that. You had this trauma, it caused the cancer. So right. Really clear with that.
Okay.
However, I don't know any chronic condition that doesn't have emotional and psychological stress surrounding it. So as we start to understand the meaning, metaphor, connections of emotional and stress factors and experiences, that the body then has a better chance to heal on a tissue level. It has a better chance to heal as we look at epigenetic expression as far as autoimmune response, genetic proteins that are being developed, et cetera, that are being created for healing within the immune system, et cetera. So it enhances, and when I speak with a client, it's about, can we look at exploring what themes this has for you? Because from a meta perspective, we look at disease as having a meaningful and biological purpose. So
let's stop. Let's have a moment here. Okay.
So, for example, I'm just thinking about somebody I spoke with the other day, and the person has Hashimoto's thyroiditis. So their thyroid level is very low. Okay. And I said, let's just explore this for a moment. If you put on the lens or the pair of glasses that says that your body is doing the best it can to overcome some challenge that isn't being met or isn't being resolved or isn't being overcome, what purpose might that be serving? Why might your body on a tissue level be delivering less thyroid? What's the purpose of most thyroid hormones? Is to increase metabolism, is to increase speed, is to increase activity. So can you tell me why you think there might be a possibility that your body is releasing less thyroid hormone? And she's like, I can tell you immediately from that perspective, because I have to keep moving. It's like, if I stop moving, everything falls apart. If I stop doing things, I feel like a failure. If I stop creating, then money goes away. If I stop, I'm seen by my family and my spouse as not being worthy enough and doing my part. So if you look at that, somebody has a belief that I have to keep gerbil, wheeling, the idea of the body saying, that's not serving your greatest and highest good. I know it's serving your belief that you're unworthy if you don't, but all of a sudden the body starts delivering less of it. So she's forced to slow down. So if we start to look through the lens that even if we just inquire what purpose might this be happening for, the least of which that happens is a person starts to be in a less adversarial relationship with their body.
Okay.
Right? So most people are in pain, hate that part of their body, my dang knee, oh my God, my shoulder's killing me. And so they end up in this adversarial me against my body role, which we know does not serve the chances of healing. Okay? So one of the things that I do, so a meta perspective looks at, okay, whatever tissue we're looking at, where something is showing up in my body, there's a reason that it may be showing up there for particular themes and purposes. So I like kind of a metaphorical approach. Our language often reveals a lot. So when somebody on a very simple EFT level, we teach about this in level 1 and 2, we listen for the metaphors. When somebody says, oh, God, there's pain in the neck, I'll often ask them, who or what in your life right now is a pain in your neck? And their eyes get wide open and they start to go, how did you know that? I didn't, I just asked you a question. If somebody feels like they use the language, I just have the stabbing pain in my back, and I ask them, is there anybody that might be in your life right now that's stabbing you in the back? And they're like, exactly. So often people don't make the connection and they don't even hear the words they're using.
And now I'm thinking, as I'm on Synthroid, I'm thinking, okay, what has my body done to tell me to slow down? And now it's okay to have a normal metabolism. So I might think about that a little bit.
Yeah. If I asked each person in their chronic health condition, if you could just stop the judgment for a moment and say, you know what, my body is this miraculous thing that's doing its best to overcome, especially limiting beliefs, emotional trauma, etc. So let's look at it this way. There are different tissues in the body and they have different purposes. If we look at, for example, our most primitive part embryologically is the part of our body that's about digestion and survival. So in other words, when I'm starting to look at my digestive system, on a metaphorical level, what we're doing is we're taking in food, but let's look at taking in information, ideas. So if I'm having problems digesting something that's going on in my life and I just can't accept it, we often see the thematic connection between digestive issues and something that's happening in somebody's life that they just can't swallow. They just can't take in, they just can't allow, or perhaps that they can't get rid of or excrete. So I just ask people, I don't name this condition means that, but I often inquire as we start to understand how powerful this connection is. When we start,
I have a tappable moment here. I'm going to be tapping on my thyroid just to see what it wants to tell me.
you know what? I love that you said that, because one of the first things in a meta health inquiry is beginning to have that kind of inquiry and conversation with that body part. How is it feeling? What is it trying to tell me? If I allowed it the space to express itself, what would it say? And that kind of inquiry, no matter what tapping or therapy or whatever you're going to do for it, if it's saying I need more of this, I need less of this, you're not giving me enough of this, you're giving me way too much of this, and we start paying attention to that, that meta health all of a sudden gives a meaning and purpose to the journey that we're on in a relationship. I look at the body as a dashboard, right? When your red brake light or oil light starts going off on the dashboard of your car, you don't want to punch it. It's like, oh, thank you. You're telling me that you're needing oil. That's useful for me. I don't go, dang, I hate when that red light, it flashes in my eye and it drives me crazy. And I wish it would stop and go away. And maybe I can just put some tape over it and Band-Aid it. Like, we don't do that with our car. We go, oh, dashboard, useful information. So if you look at your body as a dashboard, it's like, oh, that's interesting. I wonder what was going on before this that may have kicked it into gear. Because if we look at, in meta health, we look at that a tissue begins kind of at a healthy level, and then something happens. So if we begin with a healthy tissue, whatever it is, it's the muscle in, the bones in my elbow, it's a joint in my neck, it's my liver tissue, it's my thyroid follicles, whatever it is. And it begins at a healthy point. From a meta perspective, we're then going to say some traumatic moment happened that then began a process that said something is going to begin happening here to create a meaningful and biological purpose to help overcome what just happened. So we call it so there's that Uden moment, that traumatic moment that happens. What I want to say is often we have those in childhood, but then later in life, we have these triggers that happen that somehow remind our body of those original moments.
Okay.
And then they set this process into gear that we have what we call a stress trigger that sends those tissues into a stress phase. We then take some step to begin the healing. We begin a regeneration phase. We go through a healing peak. And if everything goes well and we give our body just what it needs and we meet that underlying emotional need and purpose, then that tissue can heal again. But the tricky part with that's very interesting, is we often associate symptoms and pain with things being wrong. Kind of like fever, right? Fever is an essential part of overcoming in the healing process, right? The moment we wanted to make it go away, we're eliminating the body's opportunity to heal from what it's needing to fight off. Same thing with, with our musculoskeletal system, is often something happens that triggers this, so for example, the neck is often about issues about feeling a conflict around not being able to stick my neck out, something about some sort of injustice, something about I don't feel able or up to the point of standing up for somebody else or something that's going wrong. Okay. So when that stress phase happens, it can often be over a long period of time. But when we take a step to healing and it moves into the regeneration phase, that's when inflammation and symptoms happen. Okay. But we think that when the pain starts, that's when the problems start, but it's not. And I'm going to ask you, how many people have you worked with a health condition that it began the symptoms here, right? But actually the stress that they were going under that really contributed had been going on for a long period before?
Everyone.
Right?
Right. It's my job to help them figure it out, starting with the now and then seeing where we go. I just met with a client today and she goes, Joan, I did tapping all week and I thought of this, and this. And I thought, beautiful, this is gold. So then we wrote them all down and said, this is where we're going.
The inquiry is interesting. Most people have, for example, understood that, they go through a stressful period like exams in college or something. When do they get sick?
Right before the exam.
Or actually, it's usually right out, to be honest.
Oh,
It's
okay,
usually
okay.
right after. So they're in this stress level, moving forward to do this. The moment they finish their exam and the stress is over, their body then starts to go through this healing phase, but it often gets sick during that healing phase. So it's very interesting that we have to be careful about when the symptom began, thinking that that's when the problem began. I mean, I've been a chiropractor for 25 years, and people would come in and I would say, when did it start? Like, it started yesterday. I'm like, all right, what happened yesterday? And they're like, nothing. I slept wrong and nothing happened. I must have. And I'm like, okay, well, before I understood EFT and the mental health work, it would be like, all right, I guess you slept wrong, or you just don't remember what you did. Now, through this perspective, I understand, as I start to ask, well, what's been going on for the last month or 2 or 3 or 6 that's been either particularly stressful or eventful? And they're like, oh, well, I lost my job, 2 months ago. I had to start a new job. I'm with a whole new company. I don't like it anymore. So they've been in the stress phase for some period of time, emotional stress, psychological stress. And then they finally say, well, you know what? I'm just going to let this go. I'm just going to deal with it. And as soon as they start to find a level of acceptance, often the pain starts. So the different tissues of the body have different meanings. So, for example, the musculoskeletal system is about stability and strength and performance.
Yes.
Right? I mean, think about the musculoskeletal system. It helps me move. It helps me to be upright. It helps me to be upright in the world. And so when we have pain in the musculoskeletal system, there's often history and themes and beliefs around not feeling able to move forward, not feeling able to stand up for myself, and having events and conflicts with others and self around that.
Yeah, this is so fascinating. One of the things I'm thinking and I'm listening at the same time, because I've had challenges recently with balance, not being able to stand on one foot. And then I tried to go bike riding about a week ago, and I was weaving all around this path. And I thought, so now I'm thinking, what is off balance in my life?
Exactly. Where am I missing balance? Where I'm able to not stand with stability? It's a useful inquiry, even if you were to say, well, it's not that simple. And I don't like just thinking of life and health as one big Louise Hay model of, oh, I have this, therefore that. But it begins an inquiry of understanding. So when I do a mental health consult, it's kind of a discovery about, all right, let's explore the meaning of this, both from a meta perspective, but especially individualized for the person. And if I asked you, has finding some degree of stability, is that something in your life that's been going on for maybe the last 6 months or a year, finding a stable place to stand? And if I were to ask you, you would look at that and just say, you know what? If it was true for you, that makes total sense. That's everything I've been dealing with. If it's not, it's not. So I never push it on anybody and say that, right?
I'm so excited. I'm going to go bike riding and I won't be weaving anymore.
It's amazing how powerful language is.
Yes.
Right? How language does help to describe what we're often dealing with on a psycho, emotional, sociological level. So another thing to just look at, because they're kind of interesting, is if we look at a lot of skin conditions right on the outside of the body. And we start to look at, well, what is the purpose of skin? I mean, you can say, what's the purpose of sweating and cooling and different things. But on one hand, our skin is our primary connection with the external world. It's our primary connection with others. So what we call conflict themes, traumas that happen that created a conflict within us of, what do I do about that? I don't feel able to do this. I don't feel good about that, and creates a conflict theme. That when we understand the biological meaning and purpose of, for example, when somebody starts to develop scabbing or thickening of the skin, and we simply inquire, what might be the purpose of thickening of our skin, of getting a thick skin? And it's like, well, maybe it's to protect. And maybe it's to develop more of a buffer between me and the world. And then we start to inquire, what are the conflicts that may have developed that as a purpose? May have been unwanted contact on the skin, or wanted contact that didn't happen. And so in this, the skin becomes that barrier or layer that represents that conflict contact theme between us, our territories, those around us, especially touch and contact related. So it's fascinating when we look at the themes of our digestive system, of our musculoskeletal system, of our protective barrier systems, and we start to have an understanding and meaning. So meta health inquiry begins with starting to have an understanding and make those connections so that we know where do we start to start healing? Where do we point our tapping to? Otherwise, it could just, there's a million things that we can tap on and inquire into, but a meta health perspectives gives you a direction and a theme to start to work on and release the traumas and beliefs that we need to work on that may be resulting in how it's showing up in my body now.
What is so brilliant about this is what I'm learning from you, and when I work with my clients who have trichotillomania, the compulsive hair pulling, now I'm starting to ask questions like, this might be a long shot, but I'm just curious, is there anything that you're trying to pull out of your life? We know that your nervous system is out of balance, otherwise this wouldn't be happening. But what else are you trying to eliminate through your life? What else do you want to pull out of your life? What is it about that curly, kinky hair that is so exciting to you that you wish you had more of in your life? So questions like this.
Yeah, open-ended questions. And if you look at, I always find language so fascinating metaphorically. And when we think about, if somebody describes pulling their hair out, what do you think of on a emotional level with that? Like when you hear that phrase, oh my God, I was just like pulling my hair out at the situation. You might have a different understanding, but right, or meaning, because that's your world, but I'm just curious. Because when I hear it like it's a problem that I couldn't figure out and solve. Okay. And I was pulling my hair out, trying to figure out. So it's interesting that shows up in our language. And it's very interesting that many headache and head-related conditions have to do with somebody's feelings of inability and not up to the task of being able to figure something out.
Yes.
Whatever problem is, I can't figure out how to move forward in my life. I can't figure out how to resolve this situation.
Beautiful, beautiful.
So that is one area of exploration. We can go deeper, but that's a good starting place. And for those that are practitioners or people that are just listening, if you just, again, put aside and said, okay, what does this mean for me metaphorically without even understanding the details of meta health? What were the triggers that were going on before the flare-up happened? For example, what made me, and if you do something every day all the time, I understand that's different than something that you do when there's a triggering moment, but often before the behavior begins, there's still the feeling with whatever situation is going on. It's I can't figure out how to resolve this situation, for example. I feel incapable of understanding and figuring it out.
The body-focused repetitive behavior community thanks you so much.
Yeah.
For all the skin pickers and hair pullers out there, this is a new exploration for everyone that could be so helpful down the line.
It is, because you work with that community so well. And what do I want to say? I want to be really gentle with exploring when we do things that cause self-harm. And that might be anything from not eating well to pulling our hair out to scratching our skin to smoking to, any number of things.
Right.
And if we start to develop a trauma-informed approach, that means that there's a reason that we do these things.
Yes.
Right. And, somebody had said recently, just so eloquently, they were talking about drugs and pot, et cetera, that those aren't gateway drugs. Trauma is the gateway.
Wow.
And if we look at that, whatever compulsive or addictive behavior, even if somebody else doesn't understand it, is an attempt at self-soothing.
Yes, yes, yes.
It's an attempt at reducing the anxiety. It's an attempt at reducing that part of us that has to do something to feel better than I'm feeling in this moment. Whether it's pulling hair, whether it's scratching, whether it's shrinking, whether it's whatever.
Right.
And if we really want to understand why we're doing something, we start to look to the traumas that developed limiting beliefs, that developed ways in which we devalue ourselves, et cetera. Then for us to really heal, we can like quit the smoking, but the underlying emotional venting that's still happening ends up showing up in something else. So one person quits one substance, they move on to a different behavior or substance because the underlying emotional driver for self-soothing is still there. It's just that they've changed the way that they're self-soothing.
Right.
Okay?
Yes.
So this trauma-informed approach, Dr. Gabor Mate would say, we don't even, it so informs how you live your life that the clothes that you choose to wear in the morning are informed by that. And I could see people going, okay, that's a little ridiculous. I just like red, or I just like, spandex, or I just like loose clothes because it feels good. But the truth is there's a reason that it feels good. There's a reason it makes you feel a certain way, depending on how you see yourself, how you see others viewing you, and all those different things. So trauma lies at the heart of so many psycho-emotional conditions that we develop and behaviors we adopt that then have, in other words, if I have, it's really interesting, the original LA studies came out of the obesity study, right? They were looking at very obese people, and they were working with them to lose weight. And the first people that were dropping out of the study were the ones who were losing the most weight. And Dr. Felitti was like, that doesn't make any sense. Why? They're doing great. Until he found out that almost every one of them had had early sexual abuse. And at that point, when people, and especially women, started losing weight and started to get unwanted attention in different ways, that was not safe. And their body said, done, safety, I need safety, weight gain back on again. And in our own way, we're all seeking safety based on the bad experiences and adversity we've lived through. So the need for safety drives our choices, which then drives our health and drives our physical and emotional well-being. So meta health explores these themes behind what we've lived through, the decisions we've created, the values we've adopted as a result, how that shows up in life, and then how we start to unwind the stressors, the limitations that we put upon ourselves, the conflicts, the self-evaluations, the not feeling safe. And as we start to undo that, the body has a chance to renew itself, because the body is a totally new body every 7 years. Our tissues are continually regenerating. They're just being taught and directed by the cells before that. Epigenetic expression is happening constantly, and how we direct which genes are making new proteins and which ones are not are determined a lot by our emotional and psychological state.
Oh, this is platinum. What I want to tell all the coaches, all the EFT practitioners, all the licensed therapists that are listening and watching is I will have a link in the description of this podcast, both on iTunes and in YouTube, so that you can click on that link and go to EFTtraining.com to sign up and learn more tapping, more matrix reimprinting. Definitely tapping out of trauma. Although I think you only offer it you and Suzanne only offer it 2 times a year.
We offer it twice a year, but there's lots of free interviews there, and that is for people with an EFT training. I also want to go ahead and I want to give you a link to find out more about meta health.
Yes.
So the association website is, www.
Can you put it in the chat box?
Sure. I'll just say it though. It's meta,
okay.
META,
okay.
-health.info. So meta-health.info.
Okay.
And there you can start to find out a lot more information. I mean, I do sessions with people, and you can go to, again, EFTtappingtraining.com to find out more about our trainings, and you can click on Craig Weiner. Anyway, so I'll give you some links and you can post. So Craig at EFTtappingtraining.com is the way to reach me, but also the Meta Health site is a good one to find more information out.
Because, ladies and gentlemen, if you think you know EFT, but you have not taken a class from Craig Weiner and Alina Frank, you know the beginning of EFT, but no. You really don't know EFT until you've taken one of their trainings, because anyway, that's been my experience.
Thank you. And for me, the Meta Health, you're still, anybody that works with EFT and matrix reimprinting, they work with people with health issues. This just helps give you a more beelined approach because we've all had adverse things happen in our life, to help to understand a roadmap towards which of the events and which of the themes do I need to focus on that's going to be most relevant and connected to the condition that I'm dealing with. And so that helps that process.
Combining everything in the intake, getting the history, looking at meta health, looking at the traumas of childhood. There are so many ways, so many fantastic way. The ACEs study. I love the ACEs study.
Mm-hmm.
Everything in their childhood. When I took that, I was truly blessed to grow up in a loving home, but I lost my father when I was 15. So that's one of the questions on the ACEs study is, have you lost a parent? So I thought, okay, and there might have been one more. But I mean, nobody has grown up in an Ozzie and Harriet family. So it's pretty unlikely that anyone is going to have a 0 on an ACEs study.
Right. You really see, for example, 25% of the population in America have between 1 and 3 ACEs.
Okay.
When we start hitting 4 or more, in which it really seems to escalate the effects, we're looking at about 12 to 15% somewhere in there. So about 1 in 8 people have had really at that 4 or more level. And that's when we one trauma, depending on the trauma, can affect our lifetime significantly. I mean, that's clear. We know that in our tapping work. But when you start looking at people with ACE scores of 4 or more, and remember, those are only the original 10. That doesn't count poverty. That doesn't include immigration trauma. That doesn't include witnessing violence in the streets near you. So there are many racial trauma. There's so many gender trauma. So there's so many other traumas outside of the original 10 ACEs. And those original ACE studies were done in a pretty affluent Southern California community. Wow. So when we start talking about communities in which we were born into, families and communities that have more violence, that have more, so much more adversity and challenges, then these ACE scores start really escalating higher. And, I don't want to say this, therefore that. You have more trauma, you have more health, except the research bears that out. So it's not everybody, it's not each individual, but there's a very clear correlation.
Family history, ACEs, meta health, trauma.
Mm-hmm. All these are playing key roles. So I just want to thank you, because you helping to get the word out, understanding that when we're dealing with the adversity and the negative experiences and the trauma that people have lived through, and one of or two of tapping, the different tapping modalities, right? I have a growing amount of science, actually, and I just wanted to do a quickie. Oh, yes. We created a film just called The Science of Tapping, so that people
my God, yes, thank you so much. Oh, Earth to Joan.
Yeah, so if you don't know much, if you're listening, you don't know much about EFT and tapping, you can find a lot of the research at scienceoftapping.org, right? And find studies and news items about that. But I also want to say there are many different trauma modalities out there. There's somatic experiencing, there's TRE, there's this, there's that. So there are many other ways, but these are the ones that we're finding incredibly effective. They're the ones that, I know Joan is involved with and I'm involved with, because they get amazing results quickly. And I do see, physical pain reduced rather quickly. I do see people, healing takes its course and its time for each person, because there's the complexity of the development of how it developed over time. Sometimes results are immediate. Mm-hmm. Sometimes they take longer time. Sometimes they require not only healing the trauma, but changes of behavior. Mm-hmm. And so that's a unique and individual journey. I think we need to be very realistic with that. But it's one worth exploring, especially when people have done the medical allopathic route and it's not making a difference. It's absolutely worth exploring that emotional connection and traumatic connections between the development and the ongoing keeping a condition in place, when you start to see that the body is doing its best to overcome some deeper, often subconscious circumstance.
What I like to tell everyone too, one of my favorite understandings is, no matter what modality you choose, whether it's EFT, whether it's matrix reimprinting, whether it's neurolinguistic programming, whether it's EMDR, chakra balancing, talk therapy alone is not enough when you're helping someone with trauma. That's my understanding. I put it out there in my humble opinion. You add talk therapy and cognitive behavior therapy to these other modalities, and you're really helping your client.
I think that combination can work beautifully.
Mm-hmm.
There are more studies for CBT than there are for EFT. So let's also give credit there. And I think being able to make, this was actually, let's see, I think it was Bessel van der Kolk that said, but I might be off on that. It was actually Stephen Porges. And it was saying, you know what? These ideas of what behavioral choices, if I should do this differently, how many people know I should do something different and they know it and they know that they should and they can't? So when we start to deal with trauma, we have to work and include the body, and we have to include understanding why the choices are developed. And when we start to heal those, then we can start to make those different choices. So, I love multi-pronged approaches. But yes, I think that talk alone has limitations. So
Yep. Dr. Craig Weiner, thank you so much. OMG. Thank you so much for your time, your genius, your knowledge. Thank you, God, for teaching Dr. Craig everything that you've taught Dr. Craig so he can teach us. It has just been an honor and a blessing being with you today.
Well, it's been my pleasure and honor, Joan. Thank you for inviting me.
Thank you so much. And please say hi to Alina.
Promise I will.
I want to thank everyone who's listening and watching for joining us today. And remember, there are no limits to what you can achieve, truly. Thank you and see you soon. Bye-bye, everyone.